Hi, good morning, Miss Fleming. Today I will present my presentation on the topic mutation in the FLT3 gene, possible acute myeloid leukemia cancer biomarker. Introduction and background. Acute myeloid leukemia AML is a malignant clonal disorder characterized by alterations and low production of healthy myeloid cells. These alterations exhibit differentiation of cells and induce proliferation or accumulation of blasts. AML is frequently diagnosed in people 65 to 64 years of age. Previous studies have shown that FLT3 protein has become an attractive molecular target for the development of new therapies and potential treatments. Mutations in the FLT3 gene have been found in patients with AML, 15-35%. FLT3 plays an important role as a biomarker. Problem stem goals hypothesis. In the FLT3 gene is present in the mutations of people 15-35% with AML. Then this may be early biomarker because this mutation occurs in people who develop AML. If the results are successful, it can help many people detect AML early because cancer is detected late is a progress very quickly. Methodology. The FLT3 gene will be studied with the mentor based on research and keynote legs of the mentor about the information of this gene and MLA. It will work like this for the moment until we can pass the restrictions of COVID-19 and be able to go to the laboratory to the next steps of the experiment. Study the FLT3 gene to analyze its stage of mutation. Work in the laboratory with a mentor as I need to work with a laboratory instrument. Search for antibody as indicator of the FLT3 protein. Work with a mentor in the laboratory for antibody studies. Find the shape or surface of antibody in order to detect the FLT3 protein. Work in laboratory. Run tests to see the AML detector work. Work with a mentor to test people with AML and will corner medical. Perform blood tests with this detector to 20 people who have AML. This was done in the laboratory with a mentor since the people are needed for this test. Only blood is needed to see if the detector works in the time in detectors it will not be introduced nothing in people. Mercetain necessary change to the detector if you have a problem. People will not have any risks since no chemicals are introduced into the body. Only blood is needed and there no will be risks. Tests are carried with patients of the mentor where the mentor will ask for scientific permits to be able to use the blood of the patient to perform the test. People regardless of age or gender will use as the test will conduct with the mentor patients. Collect data from the experiment with the detector to work more in the it can be relieved to detect AML and faster. Next. Methodology of result relay results analysis. And this graph shows the related results. In the figure 1, TD3 expression levels A and MFI-B in the MLD patients according to the FLT3 ITD mutation status. Patients with the FLT3 ITDT positive AML had significantly higher proportion of TDE positive blasts as compared with the FLT ITD AMLs. Miriam a 0.0% rango 0.98 versus 0.00% rango. Furthermore, there was a trend towards higher TDT-MFI levels in FLT3 ITD plus AML. Miriam 0.69, Rango 0.60.27 versus Miriam 0.00, Rango 0.30.54 point 0.08 figure 1b. This is the difference because in this show FLT3 protein ITD is significantly high proportion positive in people who have MLA, acute myeloid leukemia. Relay results. When grouping patients according to genetic characters, the proportion of TDD plus FMLA diagnosis was significantly higher in the FL3 ITD positive patients, compared with FLT ITD negative. The logistic univariate analysis confirmed the higher TD expression in terms of percentage of TDH plus in predictive of LT3 ITD mutations. This indicates the probability of identifying the mutant patient estimate by TDT expression is 69% higher in the FLT3 ITD plus than in the FLT3 ITD minus group. Also, there was a trend towards increased TDT MFI level in FLT3 ITD plus. This is shown in the first graph, A, and the first different B. This graph shows 69% FLT3 ITD plus. Discussion and conclusion. Our study supports the recent report involving of TD in the biological mechanism of priming FLT3 ITD replication slippage. In primary patient samples, we do not observe a direct correlation between TD positive and FLT ITD mutation status, but TD2 expression levels were significantly higher in FLT3 ITD positive AML. This data support the possible application of the TD enzyme in the generation of ITD mutations of the FLT3 gene, as recently reported by Burrow and colleagues. In this line, we also found a trend towards an association between higher TD MFI and FLT3 ITD positivity. In conclusion, patients with AML have a high percentage of mutation of the FLT3 gene. According to the graphs, the 69% identified FLT3 ITD mutations. Important or application future research. The impact of the FLT3 gene mutation with AML patients is the very present who develop drugs against this mutation. The 35% of the people have this gene present, so in the future research, new drugs can be developed, and it can also be a possible biomarker to detect AML quickly and accurately. My reference is Paris S.A. Chamber A. Kohler, K. Adult Acute Myeloid Leukemia, Adult Acute Myeloid Leukemia, Introduction, Epidemiology, Etiology, and Risk Factors. M.D. Anderson, Manual of Medical Oncology, 2014. And number 2, National Cancer Institute, Cancer State Facts, Leukemia, Section October 09, 2020. Y Kedon Link, M. Cassie A. Bauer A. 1994, Selective Planel Derivative Growth Factor Receptor Kinase Blocker Reverses Transformation Cancer Res. This is my presentation about acute myeloid leukemia cancer. Thank you.